That's right, Paul. It's Dr. Manny St. Victor. I'm here with board certified hypnotist Paul Ramsey, and we are on the last part of this hypnosis introduction series.
Last one. Look at me. I'm in my t-shirt. I was out in the I was washing and waxing my motorcycle, and I lost track of time. And then, luckily, my phone, I had a notification go off my phone. I was like, oh my God. And I ran in here, so I'm in my T-Rex t-shirt, and we're going to talk about ethics. That's the way it is.
I'm ready to rock. So, give me a helicopter view. What the ethics of hypnosis? What am I thinking about? You know, with much knowledge comes much responsibility.
Yeah, I think for me, I break it down into two main areas. I think the first area of ethical consideration that has to happen is what we tend to refer to as scope of practice. So, as a hypnotist, you need to consider whether what someone is requesting of you is within your appropriate scope of practice. You have licensed people and what we call lay people, right? So you have psychologists, psychiatrists, doctors, dentists, chiropractors, nurses, and maybe they know hypnosis, and because they know hypnosis, can use hypnosis as a tool to assist a patient. I'm not one of those people. I'm a lay hypnotist. I was formally educated to be a teacher. You know, I can't diagnose people, and I certainly can't treat people. So if someone calls me and they say, Paul, I have really severe depression, and you know, I can't stand using these pills, and I want to get off the pills, I wish I could help them, but that's not my scope of practice. So the best I can offer them is I can say, well, if you have a doctor or therapist who would like to bring me in and work with them and you, I would certainly be willing to do that, but I can't really treat your depression. That's not within my scope of practice.
It's sort of knowing when to
when to refer out, basically, right? I mean, so like here's another. So you know, and first of all, some of this stuff depends on what state you're in, because hypnosis is regulated at a state level. Okay. So in some states, it's completely unregulated. Technically, you can do whatever you want. But in a lot of states nowadays, there are at least some partial regulations around hypnosis. So you need to be aware of what your state regs are for your own legal safety. But then also, I think there is an ethical consideration, like pain management. Now, I've done extra training in how to help people manage pain. I do have the training, and I have that skill set. But again, if someone calls me and they say, Paul, I have chronic pain, and I'd really love to use hypnosis to manage that pain, I say, well, I'd be happy to help you, but you need to get a letter of referral from your physician telling me that they have no reason to think that hypnosis is contraindicated. So once I have that letter and I know the doctor's like, no, there's no reason you shouldn't be able to do that, then we proceed. So, you know, pain is another good example, right, of like, and you know this, you're a doctor, like pain serves a purpose.
Yeah.
So if we're just thinking purely like ethically, wanting to do good things for another person, I have an ethical responsibility to consider that we need pain to a certain extent.
Yeah.
And I don't want to just, in the interest of trying to provide relief to someone, take all their pain away.
Yeah.
Because that's how someone ends up creating another and potentially worse injury.
Yeah.
Right? If you got a bad knee and you're running around on that knee doing all kinds of stuff because you have no pain, you're going to make it worse probably. So there are considerations like that, particularly around, I would say, pain. That's the biggie. And then I think the other side of it is just you don't treat people and you don't diagnose people if you're not a medical professional. Like, that's not okay.
Yeah.
Yeah. The other side of it is sort of like, what relationship do you have with the person who's requesting something of you? I don't I don't know if I want to call it downright unethical, but I would say you're probably better served not hypnotizing your partner.
Yeah.
You know, you're probably better served not hypnotizing a family member. Um, that relationship can make things a little weird.
Yeah.
You know, like if my mom had a headache and she was like, Paul, can you just do some hypnosis to help me relax? Because I think that would make my headache go away. I'll be like, all right, mom, I'll do some hypnosis, for relaxation. Fine. But if, I had a friend. I had a friend once who came to me and she had like a weird personal habit that she had formed. And she said, could you use hypnosis to get rid of this habit? And I said, well, I can, but here's what you need to think about. That habit's being driven by the subconscious, and in my experience, it's because of some negative thing that's going on in your life.
Yep.
Are you comfortable with me as your friend knowing what that negative thing is? Right? Because what if it's, I don't know, and my instinct would say this isn't it, but again, you have to really think about the possibilities. I'm like, what if you go and you do hypnosis and you find out that your friend has developed a negative habit because they're having an affair, and the guilt of that is driving the habit? Now you're in this really awful position.
Yeah.
Right? And so when I have friends, I'm thinking that far ahead that I'm like, I don't even want to know, like, I just don't want to.
Yeah, I keep it simple like that, where people will come to me like, well, I'm feeling depressed and, I'm having an addiction problem or whatever. And I'm like, we have a relationship as friends, and where I have to go digging into your mind to get those pieces, no thanks.
Yeah, yeah. And, and so in that case, I'll say, well, I have colleagues who I respect and value that I will send you to. Because, of course, I want them to get help, But I'm just like, let's put you in touch with someone that you don't have that relationship with, and I think things will be better off. Yeah. To me, that is an ethical consideration. It's about protecting that person and your relationship with that person, So I think that's a consideration. I think if you're a stage hypnotist, there are ethical considerations about how you construct your show and how you perform on stage. I am deeply saddened to know that there are current practicing stage hypnotists out there today who routinely do things in their show with the express purpose of making the people on stage uncomfortable. Because in making them uncomfortable, it produces some sort of a reaction, which is funny, almost like slapstick, right? Like when you watch TV and someone falls down or someone gets punched in the crotch, it sort of brings out this, people tend to laugh, right? Yeah. You're like, oh my God, and so some hypnotists do that on stage. And, the common examples would be making people feel like they're getting pinched, or making people feel like they're getting jabbed with a needle in the butt. I just don't think that's okay. I don't think that's kind. And I'm like, there are better ways to be funny, And so to me, that's unethical, Yeah. So, the old, and there's very few, but I still hear stories of people, there's the old hypnotic bridge where you take a person and you lay them down on 3 or 4 chairs, right? And then you remember in earlier episodes when we were talking about ways to measure depth, we talked about catalepsy, where you get people to get things like stuck. Well, you give the person total body catalepsy so that their whole body is stiff as a board, and then you slowly withdraw the middle chairs, leaving just one chair at the shoulders and one chair usually at either like at the calves, so that their weight is supported shoulder and calves on those chairs. And they don't sag, they stay straight. And then the old school thing to do to be even more impressive was to then step up from a chair and place one foot on the person's chest and one foot on the person's thighs so that the hypnotist is actually standing on them like a bridge. They call it the human bridge. And that body catalepsy stays and completely supports the weight of the hypnotist. It's done to be impressive. It's done to wow the crowd and show how awesome you must be as a hypnotist if you can create that in a person.
Yeah.
I just don't think that's kind to stand on another human being to get an effect from the audience and risk maybe hurting their back or hurting their ribs and their chest or something like that, you know? So, you know, I think there's some things like that sometimes that those are ethical considerations about how you treat people and how you take care of people.
Yeah.
You know, there's probably like we could probably sit here and brainstorm a bunch of different probably, you know, like little examples and stuff, but I think, you know, it's about, are you keeping people safe? Are you working within your scope of practice? Touch is another one that sometimes people aren't, I don't think they're purposefully unethical, but maybe they're just not considerate. I think that touch is an important part of hypnosis, actually. There's a lot of things that you can do to make hypnosis more effective, but you got to touch people. And so I think the ethical considerations of that are, you need to discuss that with the client beforehand and make sure that they're okay with it. And then when you're in process, you should never touch unannounced. Like, you should always say, I'm going to lift your hand up by the wrist, so that they know it's coming, because it tends to scare people. They're all relaxed and peaceful and their eyes are closed, and all of a sudden you're grabbing them, you know. People can get disturbed by that, especially if they have a history of prior sexual abuse or physical abuse. So, you know, I think defining clear roles around touch. You know, even some of the suggestibility tests that you do to assess people's suggestibility involve maybe grabbing an arm, or in order to help keep them safe, putting your hand on their shoulder in case they get real relaxed and unbalanced. You can kind of help them keep balance. There's some things like that. But you should check with the person before you do the exercise. You know, and you say, and during this exercise, I'm just going to, there'll be a point where I put my hand on your shoulder to help you stay balanced. Is that okay? Yeah, okay, good. And then again, they're not surprised, and, you know, so that's another one, touching people. Relationships.
Yeah.
Yeah. You should not be dating your clients.
That's common sense.
Like, right? Like, and you know, honestly, there's some people who are like, why, what's the big deal? Like, we're in office and the other stuff's out of office. You know, and it's like, no, like, there's a relationship there, and there's trust issues and a certain level of power dynamic. This person's they're empowering you to do things with them and help them create change. Like, that gets weird if you start mixing a relationship in with it. If you have a client that you do work with, and, you know, and you're like, gosh, I wish I could go on a date with this person, then you need to choose. Either you stop working with them and you clearly define that and say, like, all right, if we want to do the dating thing, then we can't work together anymore, right? And there's even there's a form you can get, almost like, you can get like almost like a release form, you know, and say, like, look, I'm serious, like, I need you to sign this and show me that you understand that, like, you're not going to ask me to do hypnosis with you anymore because we're going to change the nature of our relationship.
Yeah.
Or, you know, if you really want to keep doing the hypnosis, then you need to let go of that other stuff. We're not going to be doing that.
Yeah.
So clearly defined boundaries, clearly defined rules, you know.
Yeah.
Don't date your clients. That's not okay.
Yeah, it's not okay. Shouldn't have to tell you, but we're telling you it's not okay.
Yeah, we should have to, yeah. You know, I could see, I guess, like, show me enough interactions, and maybe I could see one where if you just met them the first time, you did one session to help them quit biting your nails, and you're like, wow, they're really nice. You might think, it'd be nice to go on a... Maybe I could see why people would begin to think that way, you know? But it's like, okay, but no. Like, no.
There's specific boundaries, and when you...
Yeah.
When you open yourself up to the possibility, then there's a part of your brain thinking, Well, maybe if the next client is the person I date, and you just
Right, right, and all of a sudden, yeah, serial dater of
don't
clients.
date.
Not
Yeah.
okay. Not okay.
No.
Yeah. So I think that really now that's so relationship stuff. Work within your scope of practice. If you're a stage hypnotist, think about the ethical considerations of the actual suggestions you give and how they affect people. Create a safe environment for people. Don't ask people to do things that put themselves at risk. Um, I heard about a lawsuit once where I felt bad for the hypnotist because I think they probably were really innocent when they created this, but they created a suggestion for their show that the person would be when they had a trigger word, an activation word. Whenever I say this word, you're no longer yourself, you're Tarzan. And they probably were hoping that the person would just kind of do the maybe slap their chest or something,
Yeah.
like, well, you never know how people are going to interpret their suggestions. The person, what did Tarzan do in the jungle?
Swing from stuff, vines.
Yeah, right. So the person ran over and grabbed the curtain that was closed on the stage and went to swing on the curtain, and they swung on the curtain and the curtain snapped out from the rail and they fell down and broke their coccyx. And so they sued the hypnotist for causing that injury.
Yeah.
How do like, it's a bummer. I know you didn't mean to, but
you did break his coccyx.
yeah, right. You get, So I think, and that's a hard part about being a stage hypnotist is when you're trying to create entertaining things, trying to almost be like an incredible chess player where you see the 54 different moves.
Yeah.
And you can't always. I mean, I've had stuff like that happen too. That luckily no one's ever got hurt. It didn't go that far, but you have things that when you do it, somebody does. They fulfill it in a way that you never would have thought of. You're like, what on earth? Why would you do that? And you get like a little butterfly moment where you have to shut it down right away. So that stuff does happen. But you have an ethical responsibility, I think, to at least try to work really hard at seeing those possibilities and then saying, if someone could do that, is it worth risking? Because you might like the idea of the bit so much that you really want to do it, and you're like, the odds of someone doing that are so low, and you kind of want to rationalize, and I've learned that you
they're mine too.
Yeah, right. And you're like, well, if I just thought of it, they can think of it. So you just nope, that's out.
Yeah.
So yeah, I think I don't know. Is there anything that?
I think you covered it.
Yeah.
Yeah, man.
That's the last thing. That's the last one.
Yeah.
10 videos, all on hypnosis. Hopefully, folks will ask us some questions.
Yeah.
Leave questions and comments. We can do more and we can go further. But this has been really cool. Thank you so much, Manny.
Thank you, Paul. It's been a blast.
All right.
Cool. So, I'm Dr. Manny St. Victor.
I'm Paul Ramsey. Thanks for joining us.
Here. Thank you.
Stay safe.